to meet the increasing demand. Our goal is to further expand access throughout our city by making testing available to every Houstonian, especially those in our most vulnerable communities. And so we're setting up, we said a week ago or even before then that we wanted to ramp up increase our capacity to meet the increasing demand, and we are doing just that. Today, Express COVID testing is partnering with the city of Houston in opening this site. That means up to this point, there are now 5 mega sites in the city of Houston. Of course, we have Del Mar Stadium, Minute Maid, Lot C, which is in the downtown area. We opened a Butler Stadium yesterday. Today, of course, is this site here in the parking lot of Old Dave and Buster, and then the Kingwood site. So 5 mega sites, each with the capability of providing up to about 1,000 tests per day. And I said last week the goal was to get us up to the ability for the city of Houston to conduct about 35,000 tests per day. And with the opening of these mega sites, we will achieve that objective. This testing site will have a daily capacity of approximately 1,000 tests, and is operating. I have Monday through Saturday, but I think it may be Monday through Sunday. This will be a 7-day site. So this testing site will be available 7 days in District J from 9 a.m. to approximately 3:30 p.m. And appointments are not required. This site will take walk-ins. So if people want to be tested, let's say parents, teachers, kids, you name it, if they want to be tested, council member, they can simply come. No appointment is required. It will accept walk-ups. And as you can see, this site has been running beautifully, very efficiently all day. So very pleased with Express testing and the way that they are conducting business here. In addition to dozens of smaller sites across Houston, we also have mega sites at Kingwood Community Center, Butler Stadium, Del Mar Stadium, and Minute Maid Park, parking lot C. The health department is also offering testing at 4 multi-service centers and a network of dozens of sites affiliated with Curative, United Memorial Medical Center, and again, Express COVID testing. As of yesterday, just at these mega sites that were already in existence, Del Mar, Minute Maid, and Butler, they have been able to conduct over 11,000 daily tests just at those 3. And now we're adding these 2 additional sites. And when you combine that with all of the other sites that exist across the city of Houston, we will be at that 35,000 capacity per day. The Houston Health Department's operated multi-service center sites are averaging about 48 to 72 hours for result notification. The goal, by ramping up all of these different testing sites along with the various labs, is optimally to try to get test results back within 48 hours, no later than 72. And so at some sites to this point, the results may be coming back, 4 or 5 days. That's really not acceptable because we want people to be able to get these results timely enough so that they can isolate or quarantine. So the goal is to get these test results back within 48 hours, 72 at the latest, and that's what we are seeking to achieve. So I certainly want to thank Director Steve Williams and his staff and the health department. They have been working literally almost like every day, even through our holiday season, so really appreciate the staff. I want to thank all of our partners, and certainly today want to give a big thank you to Express COVID testing for joining with the city of Houston and making these test sites available. Let me first yield to Councilmember Edward Pollard, since we're in his district, and then he'll be followed by Director Williams and then by Dr. Purse, and then I'll come back.
Thank you, Mayor, and thank you to Director Williams, the entire health department, Dr. Purse, and Express COVID testing. We're in District J, which is Southwest Houston. It's the most diverse area of the city. With that, we have many challenges. We have culture barriers, we have language barriers. There are over 80 languages spoken. 75% of our residents speak a different language than English at home. And we have a lot of apartment tenants. And so we have many people in close proximity. So this is a great location for a COVID testing site. We are doing all that we can to get the messaging out to our constituents that it's important to come and get tested. We understand that there is a surge all around the country, but here in Houston, we want to do all that we can to ensure that our residents and our constituents are safe. And so we are excited about having this location in District J, and excited that we're able to put multiple locations all around the city that are conveniently located so that people can check their status and make sure that they're safe and keep their family safe. So we encourage you all to really help us with getting the word out to your neighbors and to your colleagues, to your co-workers, and to your family and friends, to ensure that they go to the City of Houston's website, know where there are testing locations, and be able to utilize them. This particular testing site, as the mayor stated, has a capacity of up to 1,000 tests per day, and we're running 7 days a week. And so this is our commitment to the City of Houston to ensure that we have enough COVID testing sites all around so that people have the capacity to go and check their status. The more we do that, the more we're able to ensure that our city will be safe and we can get back to some sense of normalcy. So glad to have you all in District J, and we're looking forward to hopefully this being a true benefit to our community. Thank you all.
Thanks, Council Member. And I want to iterate again. These sites are free. The testing is free. I want to underscore that again and again. So at all of the testing sites that we are talking about, those being conducted by the City of Houston, those being conducted in collaboration with our partners, no money is needed. These tests are free. We're not asking for credit cards. We're not asking for cash or money. If you go to any site and they're asking for that type of information, leave those sites and go someplace else. So avoid these pop-up testing sites. We are doing our very best to provide test locations all throughout the city at no charge, no cost. And they're available for whether you're documented, undocumented, immigrants. It doesn't matter what your nationality. So let me underscore this. Even if you are undocumented, okay? If you're undocumented, if you an immigrant, a refugee, whatever your status may be, if you are in our city, these sites are available to you. And I want to underscore that. So we're not turning away anyone. We want you tested, okay? We want every single person tested. Your children, you name it, come to these testing sites. No one is going to be asking you about your documented status. I simply want you to be tested so you can protect yourself, your children, your family, and your friends. And I want to underscore, just because you got tested, let's say a week ago or 2 weeks ago, doesn't mean you don't need to come back, okay? If you're around people on a regular basis, okay, if your kids are in school, then feel free. We want you to come back next week, get tested, okay? It's always better for you to know. Okay, and I think with the ownership group for this site is Capstone. It's Capstone Group. Okay, so again, we want you to don't just get tested today and figure you don't have to come back until next month. Wrong. That's a mistake. Okay, so if you got tested, for example, a week ago or 2 weeks ago, we want you to come back and get tested. In my personal case, I got tested today. Okay, and got tested 2 weeks ago. Probably will get tested next week because this Omicron virus is so contagious. And so I want to underscore that. Now let me yield. And again, we're providing testing. I mentioned Kingwood, but testing in Clear Lake, in Kingwood. Of course, we're in District J. We're in Hiram Clark, working our way to Fort Bend. All throughout the city, testing is available. But let me yield now to Director Stephen Williams of the City of Houston Health Department.
Thank you, Mayor. I want to express my gratitude to the number of partners that we have been working with to ensure that we have testing sites that meet the demand for testing for Houstonians, and certainly we recognize that people even outside of the city of Houston are accessing our testing sites. We're grateful for express testing. to open up this site here at Dave & Buster's. We're grateful for them opening up our site at Kingwood. I can tell you that this happened within less than a week of our actually becoming acquainted with them. Today I'm happy to announce that as right now we know that at this site alone has seen 345 people, and up in Kingwood they've seen 290 people. What that tells me is that the demand will continue. Just to give credit to our partners, I want to tell you that Davico is operating out of Minute Maid, Curative is operating out of Del Mar, UMMC operating out of Butler Stadium. And all of these sites we know can see up to about 1,000 people a day. The mayor mentioned that we continue to test at our multi-service centers. We have a capacity of 250 people, but I can tell you in order to meet the demand that they far exceeded that 250 and surpassed 300 on a number of days last week. I want to encourage you to get tested, vaccinated at the Houston Health Department affiliated sites. To emphasize what the mayor says, these sites are no cost to the patient. It does not require a proof of residency or citizenship or insurance. We're promoting this because we're here to protect all of the public's health. You can find nearby sites in addition to our site, certainly by going online at houstonhealth.org, or you can call for assistance at 832-393-4220 to find a nearby sites. We also know that there are other credible sites that are giving testing, doctor's offices, clinics, pharmacies, and other providers. I can tell you that our health department operated sites, the turnaround time for resulting is 48 to 72 hours. Curative is about 48 to 72 hours. UMC about 36 to 48 hours. And we are just encouraging people to access these sites because we know that testing does help because it gives you information that can provide you an opportunity to be safe around your friends and loved ones.
The best medical director in the country, Dr. Person.
Of course he is. Oh, did you say that? Okay, y'all caught that on tape, right? Okay. Okay, so everybody knows by this point that the Omicron virus, like all variants, they have their unique personalities that draw our attention. And with Omicron is that it is so very, very easily spread from one person to the next. Our latest data is showing that it is spreading at a rate faster than any of the other previous variants. And that is illustrated by the percent of virus that we're finding in the wastewater. And as we know, the wastewater has been a great predictor of what's about to happen with positivity rates and then hospitalizations. And with Omicron, the impact on hospitalizations is really an important thing that we need to understand. I'm going to talk about. But to give you an idea, the viral load in the wastewater went from 142% to 546% in 1 week. And then in our last reading, it went from 546% to 1,694%. That is a threefold increase in 1 week. That is a huge increase of virus in our community, and we're finding it in every single neighborhood. Fortunately, we are understanding that on average, most people who are becoming infected with Omicron are not having a terrible time. But that's on average. There are individuals who are still requiring hospitalization. And so a small percentage of a really big number is still a big number. And that's important because the other thing we're finding is that some folks who were previously vaccinated are becoming infected with Omicron. Now, that is not a vaccine failure. They're becoming infected, and many of them are having very mild symptoms, likely because they were vaccinated and not requiring hospitalization. But again, a small percentage of a really big number. So a small percentage of folks, whether unvaccinated, partially vaccinated, or even fully vaccinated, if they require hospitalization, that adds a load to the hospitals. And when that number is large, not because Omicron is any more deadly than anything before it, but rather simply because it spreads so rapidly and so far and wide all at the same time, that's going to put a major load on our hospitals. And this is important because our hospitals normally are operating at 95+% capacity. And so when we have surges like we saw with Delta, hospitals have to pivot. And some of the things that they have to do is they have to open up different areas of the hospital, use them for patient care areas, which are areas which were not originally designed for that. They have to take staff that were trained to do one thing and ask them to do something a little bit different and leverage them to fill in. And this is difficult now because hospitals, just like every other industry and every other employer, are feeling the impact of their own employees becoming ill and needing to stay home. So it is really, really important for all of us to pay attention to what we can do to slow this down. None of us are planning on the car accident that we might be in tomorrow night and need a hospital bed. None of us is planning on that. None of us is expecting that to happen. None of us is expecting our father-in-law's heart attack that is going to happen to somebody tomorrow night. These other things which are happening in society that keep hospitals full all the time are going to continue to happen. And so we need for the hospitals to be able to take care of not only COVID patients, but all patients. So it's incumbent on all of us as members of the community to do everything that we can to slow this down. And the things that you can do are to wear a mask, socially distance, wash your hands, get vaccinated. The vaccination, while some people are still becoming infected, they're not getting nearly as sick as people who are under-vaccinated or not vaccinated. And get tested. Testing is often overlooked for its importance because, remember, 40% of people who are infected have no symptoms. And if they don't know that they're infected, they're spreading the virus. And who are you most likely to spread the virus to? A member of your own family, the people you care about the very most. So the best way for you to protect them is to get vaccinated and get tested regularly. I want to echo what the mayor said. Getting tested regularly, because you may get infected and not even know it. The only way you'll know is if you get tested. So you need to be tested regularly, just like the mayor does and many people in the mayor's staff. The other thing I want to point out is one of our new little things for people to try to sink their teeth into is for those folks who get infected and wind up in the hospital and they never expected that they would. None of us, or nobody who got infected with any of the variants and wound up in the hospital ever thought that was going to happen. That costs thousands of dollars. Vaccine and testing are free. So they're convenient, they're free, they're reliable, and they're effective. So I would go ahead and get vaccinated, which I am, and get tested regularly, which I do, and hope I don't get infected, and do everything I can to prevent that so that I don't become ill or spread it to a member of my family. Every one of us is empowered to control our destiny. Mayor?
Thanks, Dr. Purse. And then again, we certainly want to express our gratitude with Express COVID testing. Representing Express is Aaron McKenzie. Aaron.
Thank you, Mr. Mayor, and thank you to the great citizens of the city of Houston. We are here Monday through Sunday from 9 a.m. to 3:30. Again, we are a 7-day-a-week site serving the citizens of Houston. No appointment is needed. No insurance information is required. We ask for your name, date of birth, have that ready, and we are here to serve you, your family, your friends. Thank you so much, Mr. Mayor, and the City of Houston for allowing Express COVID to partner with the city's health department to provide these free resources. Thank you, Mr. Mayor.
Again, Aaron, thank you. Mario, thank you, and everyone affiliated with Express COVID testing. Again, you don't have to be, we don't ask about citizenship, documented status, language, anything of that nature. We simply want you to be tested. But first and foremost, we want you to be vaccinated, okay? So I want to emphasize that again. Please get vaccinated. The 3 shots, not just 2, get the 3 shots. And of course, if you had J&J, 2 months have elapsed, get that booster shot. So do that. That will help out quite a bit. And then don't just get tested and 1 month and come back the following month. You need to do it on a frequent basis, and at least I would say, bi-weekly, optimally every week, so to speak. And we have these testing sites all over the city, and so we want you to take fully advantage of it. The other reason why we're setting up these mega sites as well as these others is that we want to complement what's happening with testing in our schools. We have so many kids returning. We know that's a tremendous burden on our schools, and so we want to have all of these testing sites to kind of lighten the load on the school systems in our city. So whether you get tested at the schools or you come to these sites are available to parents, to the kids, to everyone. So please take full advantage of them. Let me just stop, and if you have any questions to any of us. Yes, ma'am. Okay. Yeah. What was the question? Go ahead.
I was going to say about half an hour ago, County Judge Dagos spoke about another court allowing the mask mandate here in Harris County or
Okay. Are you referring to the Court of Appeals that essentially said that the governor did not have the authority to prohibit the requirement of mask mandate? Look, let me just say, we encourage people to put on their masks. Even as we move forward into 22 with the activities that are taking place, we encourage people to wear masks. Already, for example, require city employees, when they are working and they are around other city employees, they must put on their masks. That is a requirement for city employees. So I simply believe at this point, I think we know a lot more today than we knew 2 years ago. And we know today that masks work. In addition to the vax and to testing, masks do work. So, I applaud the decision, and we'll see what happens. We know with these decisions, they end up being appealed, and anything can happen. But at this point in time, we shouldn't have to require a court to tell us what we to do. Everybody that I'm looking at right now, we all have our masks on. It didn't matter what a judge said. So let me encourage people to do the same. But I do think it's a plus to know that locally, mask requirements are okay. We'll see how long that holds. Director Williams.
Yes, we had chosen a site, but that site didn't work out, and so we're looking at alternative sites in Clear Lake, yes. No, I don't have information. There are about 4 or 5 sites that we're looking for in that area, reviewing in that area. Well, there are a number of factors. The demand does factor into that, but also you have to look at staffing levels. As you know, every industry within this country has been affected by COVID. Certainly, if you look at the health department itself, I have 60 people that are out related to COVID. And so the turnaround time actually is heavily influenced by staffing. I think that's probably been the major issue that has affected turnaround times that have been longer than we initially expected.
Yes. Okay, and let me defer to Dr. Purse on that, on the positivity rate. Repeat the question again.
Yeah, so we usually report a positivity rate weekly, but due to the holiday and having employees out ill, we don't. That's a rolling average. So I don't have what the calculate. But what I can tell you is over the last several days, our lab has been reporting a positivity rate of over 50% from certain sites. Now that's not inconsistent. The Texas Medical Center is seeing numbers in the same area. And they always run, our number's always a little bit higher than theirs. It's a different patient population because they test people who are planning on having outpatient procedures who think that they are fine, and so they're surprised and we test people who are concerned that they've got symptoms or concerned they got ill. So it makes sense that our percentage would be a little bit higher than theirs. But we're up in the 40-50% range for sure, I think. Oh, okay. Is that what I hadn't seen that. Okay. Yeah. Well, we're doing things like this. We're opening up more and more testing sites. The mayor and Director Williams are pushing very hard to get more and more testing sites. And really our greatest weapon, quite honestly, is you. It's educating the public. There is no magic bullet that we have other than vaccine. And so it's educating folks. So those that are not yet vaccinated will go get vaccinated. Whether you're vaccinated or not, get tested, wear your mask. I mean, you have to keep in mind, the virus is the enemy, right? The virus doesn't really have an agenda. It's going to do what it's going to do. We have now learned a couple of things over 2 years. One is that this virus, each of its variants, it breaks all the rules of the way viruses normally behave. However, it has been relatively consistent in that it is an aggressive spreader. It will capitalize on our weaknesses, and that being the elderly, people with chronic illness. It doesn't limit it to that. It has infected, made seriously ill, hospitalized, and killed people who are otherwise totally healthy. Viruses generally don't do that. So we need to be educated. That's what we're doing. We're trying to educate people to empower themselves to do what they can to protect themselves and their families, and providing them easy access to vaccine, easy access to testing. And of course, the masks are ubiquitous now. And beyond that, it's how you control your own behavior, where you decide to hang out. Are you in a crowded place with nobody's wearing a mask? Probably not the best thing to do right now. Are you outdoors like we are, keeping apart from each other, wearing masks? This is a very safe environment right now. So that's what we're doing. So a couple of things. If you are having symptoms and if you believe that you have COVID, then you need to isolate yourself. We isolate the folks that are sick. You can get tested, or if you decide you don't need to because you're just convinced you have it, then you need to behave as if you have it, which means currently the recommendation is to isolate at home, which means, and this is important, I'm glad you asked the question, that means you really, ideally, you would stay in your bedroom and have somebody bring you your meals, and not be in contact even with your own family members. Remember, that's the person you're most likely to infect is a family member, for a minimum of 5 days. At the end of those 5, even if you start feeling good on day 2, you stay isolated for a minimum of 5 days, because you are probably still producing and able to spread virus. At the end of the 5 days, if you have no symptoms, you can return to the regular, world, if you will, but you need to continue to wear a mask. And the reason is that even though you're feeling better, there's still a chance you could be spreading virus. So you don't want to do that. You do that for an additional 5 days, so a total of 10 days. So that's what I would recommend people do. Now, during that time, if you get sick with a capital S, you get worse, call your doctor. If you've got immune problems, if you've got high risk problems, you got heart disease, immune problems, you're a chemotherapy patient, you need to call your doctor very early to see if you would qualify for the monoclonal antibodies. And of course, right now there's a terrific shortage of those. So you and your doctor need to strategize how to get them if you would qualify. But if you are somebody who's in that category, as soon as you become symptomatic, you need to reach out to your doctor. They're probably going to want to get you tested to confirm it, but you don't want to wait until you're really, really sick to do that. And for the rest of the folks who don't have those underlying illnesses, if you become seriously ill, you need to reach out to your doctor. You may require hospitalization. And if you do, the sooner you get hospitalized, the better. And keep in mind, our hospitals are all very full right now. So be proactive in protecting yourself. Be smart. All of us are now well enough informed that we can be smarter than the virus. And that's what you need to do. The mistake you can make is to underestimate this virus. I mean, tragically, I think we've seen around the globe in a lot of individual situations where we've underestimated what this virus can do. And we've dropped our guard. And you know the rest of the story. What is the time in incubation for the virus to start getting? Yeah, so excellent question. I'm glad you asked. This is a mistake that we have seen. So if you are in close contact with somebody who turns out to be positive, a great example is you visit with a family member or a colleague at work or a neighbor or whatever, and a day or two later they call you and say, oh my gosh, I got to let you know I just tested positive, and we did whatever together and we were close. You're a contact of a known case. In that case, you need a quarantine for 5 days. And quarantine is basically the same as isolation, except you don't know whether or not you're sick. And at the end of those 5 days, you should test. Now, the reason you wait for 5 days is that if you test before then, there's a good chance that you will get what we call a false negative. Once you're infected, your body takes a little time to start producing enough virus so that the test will find it. If you test too early, you will get a negative result, and then you think, oh, I'm good. And then when you develop symptoms, you'll say, oh, it's just allergies, it's just a cold, it's whatever. And you're going to spread the virus to a whole bunch of folks. And, and completely defeat the purpose. So you need to wait, and the current recommendation is 5 days to test after you've been exposed to somebody. And that's 5 days, not from when they tell you, it's 5 days from when you were with them. So if you're with them on day 1, so it's actually day 0, and then they tell you on day 2, right, it's 5 days from when you were with them. So that may be 3 days after they told you, depending on the circumstances, okay? All right.
And let me remind people again that we've been here before. This is like the 4th or 5th surge. So we've been through this before. We've gone through this drill time and time and time again. I will tell you, there are a lot of people who are walking around saying to themselves, what I'm suffering from is a sinus infection. I've got an itchy throat. It's probably the onset of a cold, or I got a head cold, so I'm okay. I'm good, okay? And you could be walking around with COVID, okay? Because in my situation, I would tell you, it was simply a slight itchy throat and a slight cough. I just decided before I started my day to go and get tested, and the results came back positive. So if you're walking around saying to yourself, it's just a sinus infection or a head cold, and you're in the midst of everybody else and you have taken off your mask, then you are a spreader, and that will up the positivity rate. So right now, let's say in many locations, the positivity rate is 50%. That means 1 out of 2 people being tested is coming back positive. So that's, those are ways that you can stop it by getting tested early enough and often, so that if you are walking around with this virus, that you can start to isolate or quarantine and keep it from infecting other people. Now, if you will, let me bring up Ada, because I do want to emphasize the importance that no cost and citizenship is not required. So Ada, if you'll do that in Spanish.
Muy buenas tardes. Hoy estamos aquí en el sitio de pruebas de COVID, el 5º sitio que la ciudad ha abierto, y es en asociación con Express COVID-19 testing. Y el alcalde les quiere asegurar, ¿verdad? Y quiere recordarle a la comunidad que por favor se hagan las pruebas y que no tengan miedo, ¿verdad?, de que no los van a aceptar por su estatus inmigratorio. Las pruebas son gratis para todos, para toda la gente. Solo tiene que venir, inscribirse y hacerse la prueba. Es todo. Gracias.
Okay, I think that'll wrap us up. Again, this testing site will be open 7 days a week from 9 till 3:30. And in District J, the old Dave and Buster in the parking lot in District J off of Richmond. What block is this? 6010 Richmond Avenue. 6010 Richmond Avenue. Open 7 days a week, and it's open to each and every one. Okay, no cost at all, from 9 to 3:30. That's this particular location. But then you can also go to the mega site at the Kingwood Center, or Del Mar Stadium, Butler Stadium, or Minute Maid Lot C. Any one of those, and then all of the other public health centers located throughout the city of Houston. Please take advantage. That's the one way that we can bring this virus, stop the spread of this virus, is by getting tested. And again, let me underscore, get vaccinated. For those who just haven't gotten it done at all, let me focus on those who have gotten vaccinated, but they haven't gotten that 3rd shot. So please get the booster shot, and then we can enjoy the parades, we can enjoy the rodeo, and it'll be a good time in the city of Houston. We're not shutting down, we're not closing down, but it is important to learn from what we have experienced over the last 2 years in order to move forward, and that's what we're seeking to do. And this is a beautiful day in the city of Houston. Let me just put another pitch for those who are living on the East Coast, the West Coast, up north. No better place to be dealing with this virus than right here in the city of Houston, because you can be outside in January in 2022 and enjoying a beautiful, beautiful day. That's for right now. 5 hours from now, it can certainly change. Okay, thank you, and enjoy 2022. Happy New Year, everybody. Mario, thanks again. Appreciate you. Thank you, my friend. Thank you.
We're trying to get a photo, have them, while there's a little bright, have them socially distanced. Get a photo, just socially.